Okay, folks, so welcome to this week's lesson, Chapter 7, Blood Collection, Equipment, Additives, and Order of the Draw. So as you know, the primary duty of the phlebotomist is to collect blood specimens for the lab. Blood's collected by several methods, including arterial puncture, not that common, but capillary puncture and mostly venipuncture. This chapter is going to describe the general blood collection equipment and supplies commonly needed regardless of the method of collection, the equipment specific to venipuncture, and the additives used in blood collection, and most importantly, the order of the draw for collecting or filling blood specimen tubes. So to just go over some of the objectives of this week's lesson. Number one, we want to list, describe, and explain the purpose of the equipment and supplies needed to collect blood specimens by venipuncture, and define the associated terms and abbreviations. Number two, list and describe evacuated tube systems, or ETS, and syringe system components. Explain how each of these systems works, and tell how to determine which system and component to use. Number three, want to demonstrate knowledge of the types of blood collection additives, identify the chemical composition of the specific additives within each type, and describe how each additive works. And describe the ETS tube stopper color coding used to identify the presence or absence of an additive, connect additives and stopper colors with laboratory departments and tests, and list the order of the draw and explain why this is important. So the following sections are going to describe the equipment and the supplies commonly needed for all methods of collecting blood specimens. First thing is to talk about is your blood drawing station. A blood drawing station is a dedicated area of a medical lab or clinic equipped for performing phlebotomy procedures on patients, primarily outpatients sent by their physicians for laboratory testing. A typical blood drawing station includes a table for supplies, a special chair where the patient sits during the blood collection procedure, and possibly a bed or reclining chair for patients with a history of fainting, persons donating blood, and other situations. A bed or padded table is also needed if heel sticks or other procedures will be performed on infants or small children. Phlebotomy chairs are designed for patients who have their bloods drawn while in the seated position and must be seated in a commercial phlebotomy chair or at a minimum a comfortable chair with armrests to provide support for the arm to prevent falls. Most have adjustable armrests that allow proper positioning of either arm, and they lock into place to prevent the patient from falling should fainting occur. Some even have hydraulic height adjustments. Chairs that recline to accommodate the patients who have a history of fainting are also available. Handheld phlebotomy equipment carriers or trays, like in the picture that you see in the slide, come in a variety of styles and sizes designed to be easily carried by the phlebotomist and to contain enough equipment for numerous blood draws. They're convenient for stat or emergency situations or relatively few patients need blood work. So these are usually used when a phlebotomist is called for emergency on the hospital floor to get a stat specimen. The phlebotomy carts, like what you see here, are typically made of stainless steel or strong synthetic material. They have swivel wheels which glide the carts smoothly and quietly down hospital hallways and in and out of elevators. They normally have several shelves to carry adequate supplies for obtaining blood specimens for many patients. Carts are commonly used for early morning hospital phlebotomy rounds when the patient needs lab work, and for scheduled sweeps, or rounds that occur at regular intervals throughout the day. The carts are bulky and a potential source of what we call nosocomial infections. If you learned before, those are hospital-acquired infections. They're not normally brought into the patient's room. Instead, they should be parked outside of the hallway. A tray of supplies located on the cart is usually taken into the room and carried off to the patient. Now, because of the advent of bloodborne pathogens, the CDC and OSHA have all required bloodborne pathogen standards that require the wearing of gloves when performing phlebotomy. New pair must be used for each and every patient and removed when the procedure is completed. Non-sterile, disposable, nitrile, neoprene, polyethylene, and vinyl examination gloves are usually acceptable for most phlebotomy procedures. A good fit is essential. Due to the prevalence and advent of latex allergies, latex gloves are usually no longer available. Glove liners can be used if gloves cause allergies or dermatitis. Barrier hand creams can help prevent skin irritation from gloves. Gloves with powder is not recommended because they usually can cause allergic reactions to patients. And as you can see here, this is just an example of cloth ultra-fit glove liners which fit over your hand but under the glove to help prevent skin reactions such as dermatitis. It's also important to note that decontamination of hands after glove removal is essential. Any type of glove may contain defects or micro tears that result in contamination of the hands that might not be visible. And some studies suggest that vinyl gloves may not provide an adequate barrier to viruses. So in which case we want to use some other tools in our arsenal, such as antiseptics, which prevent sepsis or microorganisms or toxins in the blood. Usually they contain about 70% isopropyl alcohol for most common routine blood collection. They're safe on human skin. The problem is with any alcohol-based preparation, alcohol tends to evaporate very quickly, so it doesn't stay on the skin for a very long period of time. Disinfectants are chemical substances or solutions regulated by the EPA that are used to remove or kill microorganisms on surfaces and instruments. They're stronger, more toxic, and typically more corrosive than antiseptics, and are not really safe for human skin. Disinfectants do not kill bacterial spores like you would see in anthrax, so reusable medical equipment must be sterilized before reuse. Hand sanitizers are great in a pinch. They're great for getting germs and most viruses and most bacteria off of your hands. However, they do not replace hand washing if your hands are visibly soiled. Remember that alcohol-based hand sanitizers do not kill everything. They're very difficult to kill certain organisms like C. diff and MRSA and anthrax, for that matter. So you'll commonly see hand sanitizer stations at various locations of the facility you're working at. The CDC guideline for hand hygiene in healthcare settings recommend the use of alcohol-based hand sanitizers for routine decontamination of hands as a substitute for hand washing, provided that the hands are not visibly soiled. If hands are heavily contaminated with organic material and hand washing facilities are not available, it's recommended that hands are cleaned with detergent-containing wipes containing the use of an alcohol-based hand cleaner. Alcohol-based hand cleaners are available in rinses, gels, and foams and come in various types of containers, including personal-sized bottles and wall-mounted dispensers, like you see in the picture here. Most phlebotomists usually carry their own personal bottles of hand sanitizer just to keep with them at all times. So some other tools in the phlebotomist's arsenal include gauze pads, which are clean 2x2 sterile pads that are used to hold pressure over the site of the following blood collection procedures. There are special gauze pads with fluid-proof backing that are also available to help prevent contaminations of gloves from blood at the site. Use of cotton balls are not really recommended, as you might have seen in the past in your own personal lives, because cotton fibers tend to stick to the site. Consequently, when the cotton ball is removed, the platelet plug sealing the site can be disrupted and bleeding reinitiated. Bandages are adhesive covers that are used to cover a blood collection site after the bleeding has stopped. Paper, cloth, knitted tape placed over a folded gauze square can be used. Self-adhesive gauze placed over the gauze pad and wrapped around the arm is increasingly being popular, especially for patients who are allergic or sensitive to adhesive bandages. It's also used to form a pressure bandage following an arterial puncture or venipuncture in patients with bleeding problems. Latex-free bandages are also available for use on those with latex allergies and sensitivities. Some other equipment that a phlebotomist should carry on their person are pre-cleaned 25 by 75 millimeter glass microscope slides, which are used to make blood films for hematology determination. Slides are either available plain or the frosted area on one end where the patient's name can be inscribed. Obviously, a pen where a phlebotomist should always carry with a permanent non-smear ink to label tubes and records after patient information. A wristwatch, preferably with a sweep, clean hand or timer, which is needed to accurately determine specimen collection times and time certain tests. And most importantly, patient identification equipment. Many healthcare facilities use barcode technology to identify patients. The barcode is the ID band, and phlebotomists carry barcode readers to identify patients and generate labels for the specimen tubes. Radio frequency identification systems are also gaining acceptance. We'll see Chapter 12 for more information on that material. And again, what you see here is a diagram of all the various equipment that the phlebotomist has available to them, including specimen bags, proper sharps disposal containers, large ones, portable ones, very important to prevent accidental needle sticks on the job. Some advanced technology that's gaining some acceptance in this field are vein locating devices. Although they're optional and they tend to be very expensive, these are portable devices on the market that use transillumination to make it easier to locate veins that are difficult to see or feel. These devices typically shine high-intensity LED or infrared light through the patient's skin to highlight veins. The hemoglobin in the blood within these veins absorb the light, causing the veins to stand out as dark lines. These devices can be used pretty much on patients of all ages, and they're gaining more and more popularity if your facility has the budget to purchase them. So, a tourniquet, or what I like to call a VCB, venous constricting band, because I use the term tourniquet when I talk about first aid and hemorrhage control. But it's a device that's applied or tied around the patient's arm prior to venipuncture to compress the veins and restrict blood flow. A properly applied tourniquet is tight enough to restrict venous flow out of the area, but not so tight to restrict arterial flow into the area. Restriction of venous flow distends or blows up and inflates the veins, making them larger and easier to find, and stretch the vein walls so that they're thinner and easier to pierce with the needle. Restriction of the blood flow can change blood components if the tourniquet is left in place for more than 1 minute. So that's a very important board question. A tourniquet should be placed on arm for no longer than 1 minute. So a tourniquet must fasten in a way that's easy to release with one hand during blood collection procedure or emergency situations, such as when the patient starts to faint or the needle accidentally backs out of the arm during venipuncture. And we'll get practice on how to properly apply and remove a tourniquet during the lab component of this course. So probably the biggest tool of the phlebotomist is the needle itself. Phlebotomy needles are sterile, disposable, and designed for single use only. They include multi-sample needles, hypodermic needles, and winged infusion systems. Also, non-winged blood collection needles sets used with both evacuated tube systems and syringe systems. Multi-sample needles are commonly enclosed in sealed twist-off shields or covers. Hypodermic needles and blood collection needle sets are typically sealed in sterile pull-apart packages. Specific terminology is used to refer to the parts of a needle. The end that pierces the vein is called the bevel because it is cut on a slant. The bevel allows the needle to easily slip into the skin and vein without coring or removing a portion of the skin or vein. The long cylindrical portion is called the shaft. The end that attaches to the blood collection device is called the hub, and the internal space of the needle is called the lumen. Needles are available in various sizes indicated by what's called the gauge and the length. The cover or cap of a needle is sometimes called the needle sheath. Needle gauge is indicated by a number that's related by the diameter of the lumen. A needle's diameter and gauge have an inverse or opposite relationship. That is, the higher the gauge number, the smaller the diameter of the needle. Although blood typically flows more quickly through large diameter needles, needle gauge is selected according to the size and condition of the patient's vein, the type of procedure, the volume of blood to be drawn, and the equipment being used. Appropriate needles for the collection of most blood specimens and laboratory testing includes gauges 20 through 23. However, a 21 gauge needle is considered the standard for most routine adult antecubital venipunctures, AC. The 22 gauge needle is often used for smaller veins. Common venipuncture needle gauges with typical needle and typical uses are listed in your textbook. Needles are available with or without safety features. Safety features must provide immediate, permanent needle containment and be activated using one hand, which must always stay behind the needle. Safety features include resheathing devices, such as shields that cover the needle after use, blunting devices, and devices that retract the needle after use. The FDA is responsible for clearing medical devices for marketing. In your textbook, there's a list, box 7.2, which lists desirable characteristics of safety features that the FDA considers important in preventing percutaneous injury. Some of these features include a fixed safety feature that creates a barrier between the user's hand and the needle at the time, a feature that allows the worker's hands to remain behind the needle at all times, and so forth. So one of the most important tools you're going to need to be familiar with is called the evacuated tube system, or ETS. It's the most common, efficient, and CLSI preferred system for collecting blood samples. It's a closed system in which the patient's blood flows through a needle inserted into a vein directly into a collection tube without exposure to air or outside contaminants. This system allows numerous tubes to be collected with a single venipuncture. ETSs are available from several manufacturers, although the design of individual elements may vary slightly by manufacturer. All ETS have three basic components: a special blood drawing needle, a tube holder, and evacuated tubes. Now, some components of your ETS involve a multi-sample needles, because they allow multiple tubes of blood to be collected during a single venipuncture. They're threaded in the middle and they have a beveled point at each end. The threaded portion screws into the tube holder. The end of the needle that pierces the vein is stronger and has a longer bevel. The shorter end penetrates the tube stopper during the specimen collection. The tube stopper is covered by a sleeve that retracts as the needle goes over through the tube stopper so that the blood can flow into the tube. You'll see a video on how this works at a later time. When the tube is removed, the sleeve slides back over the needle to prevent blood leakage. ETS needles are available with or without safety features. Color-coded needles shown in your textbook are traditionally styled multi-sample needles without safety features. And as you can see here, this is what a safety needle and traditional tube holder looks like. Evacuated tubes filled with blood automatically because there's a vacuum or negative pressure within them. The vacuum is artificially created during the manufacture by pulling air from the tube. The amount of vacuum, in other words, the amount of removed air and negative pressure created, is measured precisely by the manufacturer so that the tube will draw the exact volume of blood indicated on the label. To reach its stated volume, the tube must be allowed to fill with blood until the normal vacuum is exhausted and blood no longer enters the tube. A tube that's been prematurely lost or part of its vacuum will fail to properly fill with blood. It's important to know that premature loss of vacuum can occur from improper storage, opening the tube, dropping the tube, advancing the tube too far onto the needle before the venipuncture, or if the needle bevel becomes partially out of the skin during venipuncture. Most evacuated tube systems contain some type of additive. An additive is any substance placed within the tube other than the tube stopper, or the tube glass itself, the silicone coating. Tube additives have one or more specific functions, such as preventing clotting or preserving certain blood components. Blood collected in additive tubes may or may not clot depending on the additive type. If the additive prevents clotting, the result is a whole blood specimen. Some whole blood specimens are used directly for testing, others are centrifuged to separate the cells from the fluid portion, in other words the plasma, that is used for testing. If the additive is a clot activator, the blood will clot and the specimen will be centrifuged to obtain the fluid portion, in other words the serum, used for testing. The amount of additive in a tube that's been calibrated by the manufacturer to function optimally and produce accurate results within the amount of blood it takes to fill the tube to the capacity or volume indicated on the tube label. Specimen quality can be compromised and lead to inaccurate results if the tube is underfilled, so it is important to allow additive tubes to fill with blood until their normal vacuum is exhausted. Very few tubes are additive free. Even serum tubes need an additive to promote clotting if they are plastic. The few non-additive plastic tubes available are used for clearing or discarding purposes and limited other uses. Examples would be the Vacuit gray top tube and the BD clear tube. A few glass non-additive red top tubes still exist, however their function is relatively rare, but most other glass tubes have been discontinued for safety reasons. Blood collected in a tube will clot when there is nothing in the tube to prevent it. Tube stoppers are typically made of a type of rubber that's easily penetrated with a needle, but seals itself when the needle is removed, just when you're adding air into a basketball or a football. Some tubes have a rubber stopper covered by a plastic shield. The shield is designed to protect lab personnel from blood drops remaining on the stopper after the tube is removed from the needle, and from aerosols or mists and sprays and specimens of any blood on the stopper or rim of the tube when the stopper is removed from the tube. The rigidity of the plastic also prevents removal of the stopper using a thumb roll or pop-off technique that has been shown to cause aerosol formation. Tube stoppers are also color-coded. For most tubes, the stopper color identifies the type of additive placed in a tube by the manufacturer for a specific purpose. However, for some tubes, the stopper color indicates a special property of the tube itself. For example, a royal blue stopper indicates a tube is free of a trace element contamination as possible rather than a type of additive. The BD tan stopper tube is certified to contain less than 0.01 micrograms and leads to its use for proper lead tests. Occasionally there's more than one stopper color for the same additive. In addition, although color coding is generally universal, it may be slightly different going from manufacturer to manufacturer. So manufacturers guarantee the reliability of additives and tube vacuum until an expiration date that is printed on the label, provided the tubes are handled properly and stored between the proper temperatures, between 4 degrees and 25 degrees Celsius. Improper handling or storage can affect additive integrity and tube vacuum, which can lead to compromised test results or improper filling. In addition, excessive heat can often soften and distort plastic tubes, so it's always important to pay attention when you're prepping your sample to make sure you're using equipment of proper expiration dates as well. And as you can see here, there's a number of different colored evacuated tube systems with different colored stoppers of different sizes, different volumes, all for maintaining a different type of test or procedure. Now, although the evacuated tube system is a preferred method of blood collection, a syringe system is sometimes used for patients with very small and difficult veins. This system consists of a sterile syringe needle called a hypodermic needle, a sterile plastic syringe with a luer lock tip, which is a special tip that allows the needle to attach more securely than a slip tip. A syringe must be about 1 to 1.5 inches long, must have a resheathing feature for safety purposes, and it also contains a barrel, which is the chamber in which the fluid is drawn into and contained, and a plunger, which pulls back and sucks out or draws the blood into the specimen barrel. And this is an example of what your syringe type system would look like. On the far left, you see its safety feature where the needle can be capped using a single finger, a thumb device. The graduated barrel gives you an idea of how much volume of blood is withdrawn, and the plunger is pulled back upon in order to withdraw blood from the vein itself. So the syringe system transfer device allows safe transfer of blood into tubes without using a syringe needle or removing stopper. So let's talk about some of the blood collection sets you'll be using. For example, a winged infusion set, which is commonly referred to as a butterfly, has a plastic extensions that resemble butterfly wings attached to the needle where it's joined to the tubing. During the use, the needle may be held from above by gripping the wings together between the thumb and the index finger, thus allowing the user to achieve the shallow angle of needle insertion required to access small veins. They're very effective for difficult veins as well. Some newer blood collection sets do not have wings. One example is called a Vanish Point, which has an automated in-vein retraction after blood collection to eliminate exposure to the contaminated needle. Either way, you can see that the winged infusion sets attach either directly to a syringe or by means of an evacuated tube holder by means of what's called a luer adapter, which you can see on the left. There are some combination systems, for example, the S-Monovet blood collection system, shown in your textbook, which is a complete multi-sampling venous blood collection system that can be manipulated by the user to perform either vacuum and or gentle aspiration of blood collection based on the condition of the patient's vein. No sample transfers are required with either technique. The tubes are available with a full range of additives and in various sizes and come from volumes from 1.1 to 9 milliliters. The tubes connect securely to one-piece safety needles. A fixed needle protector covers the front needle after use, and a small integral holder protects the user from the back end of the needle as well. And as you can see right here, this is an example of the Sardet S-Monovet venous blood collection system. Again, this is only one commercial brand of many that may be out there for your use. Thank you very much. Bye-bye.